Okay, well, even though I'm a surgeon, you might be surprised by my answer, which is no, I don't. Now, in terms of muscle-invasive bladder cancer, I do think that it is reasonable to say that neoadjuvant chemotherapy and surgery inappropriate with patients who are appropriate for chemotherapy and cystectomy is the gold standard for muscle-invasive bladder cancer. However, we are seeing increasing evidence supporting the role of trimodal therapy, and it may be in the future that we're actually looking at quadrimodal therapy, so the addition of immunotherapy into chemo radiation following TURBT for bladder cancer. And it certainly there was a recent study published in the Lancet, and though it wasn't a prospective randomized study, it was a propensity score matched study, which is probably all you're ever going to be able to achieve these days. We've tried to randomize patients between radiation and surgery, it doesn't work, and that really did show equivalent outcomes in that study. So it's a vexed issue, and if you can preserve the bladder, and also obviously if you're preserving the bladder and the bladder is functioning and there aren't other complicating or symptomatic side effects from the radiation, and often these aren't very well measured in those sorts of studies, then that might be better. But yeah, I do actually, though it's popular for surgeons to suggest that the only form of bladder preservation should be formalin, I don't actually agree with that.